Namaste बिटिया हमेशा खुश रहो बिटिया. A very good morning to you all. Myself, JVN Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine in Faculty of Homeopathic Science at JAYOTI Vidyapeeth Women's University, Jaipur. In today's session, we are going to discuss about a very important disease that is affecting a lot of people, and it is basically associated with the pigment disorders of the skin, especially the melanin pigment. So let's start our lecture with vitiligo. Vitiligo, or in the layman term, it is known as leukoderma. What is vitiligo? Vitiligo is an acquired condition that is in which the circumscribed depigmented patches develops surrounded by the normal skin. So what is happening in vitiligo? There are patches that are developed. There are certain patches of the depigmentation that are developed, and these are surrounded by the normal skin. So what is happening in vitiligo? There is pigmentation. There are circumscribed pigmentation patches that are developing and are surrounded by the normal skin. Vitiligo is affecting around 1% of the population worldwide, and it involves the focal areas of melanocyte loss. So what is happening in the vitiligo? There are circumscribed depigmented patches that are developing around the normal skin, and it is affecting around 1% of the population worldwide. It involves focal loss of melanocyte cells. So melanocyte cells are basically the cells that are responsible for the production of uh, melanin pigment that provides color to the skin. So loss of melanocyte cells result into the reduced production of melanin pigment, leading to the hypopigmented areas. Based on the distribution on the body, the melanin pigment or the melanocyte loss can be localized, that is related to a particular part of the body. It can be generalized, that is involving more than one part. It can be universal, that is present on whole of the body. Nothing is left and it is present on whole of the body, means universal. And the fourth is the halo nevius. So based on the distribution, it can be of four types. We have localized, we have generalized, we have universal, and we have halo nevius. I have given the pictures of few PPTs, few patients having the vitiligo according to the classification. So you have to go through those pictures given in the e-notes, and then you have to learn accordingly, because in dermatology we learn by looking at so many cases. So go through the e-notes and have a look at the pictures that I have uploaded on the portal. Now, what is the incidence? Incidence of development of vitiligo. The patients of vitiligo are seen worldwide. So there is worldwide distribution, and it is common in India. It is common in certain areas of Gujarat and Rajasthan, and it is also present in Egypt and the tropical countries. It is also affecting all the age groups. Means it can affect any age group. The people of any age group can get affected by vitiligo, and it has predilection for both the sexes. Equal predilection means it is common in males as well as females. There is no specific sex predisposition. Many cases start at 5, 15, or at menopause. So the cases are starting at the age of 5 years, 15 years, or at the age of menopause. And there can be positive family history of the order in those with generalized vitiligo. So in case of vitiligo, generalized vitiligo, we can also get a family history in the patients. Means their parents, grandparents, and someone in the family can be affected with that particular disease. Now, what is the etiopathogenesis? Etiopathogenesis means what are the different causes that are responsible for development of uh, vitiligo. There are certain theories that are given. Exact cause is not known, but certain theories are given to explain the etiopathogenesis of vitiligo. So the theories can be divided into four things. One is autoimmunity. The next one is the neurohormonal factors. Third is the autocytotoxicity, and the fourth is the exogenous chemical exposure. So in the etiopathogenesis, there are four different theories that are given. One is autoimmunity, second is neurohormonal factors, third is autocytotoxicity, and the fourth one is the exogenous chemical exposure. So in the autoimmunity, there are certain antibodies against the adrenal gland the thyroid cytoplasm that are developing. Actually, a reaction pattern to drug infection and toxin is seen in this particular type. The second is the neurohormonal factors. So there are certain neurohormonal factors that are responsible for development of vitiligo, which includes neurotoxic agents. We have norepinephrine, we have catecholamines that inhibit uh, melanogenesis and have the toxic effects on the melanocytes. The third theory is the autocytotoxicity that consists of self-destruction of the melanocytes. There is also exogenous chemical exposure that includes thiols, phenols that inhibit the action of tyrosinase and causes cytotoxic action on the melanocytes. So we have autoimmunity, in which there are antibodies against the adrenal, thyroid, and cytoplasm. Second is the neurohormonal factors, which includes the neurotoxic agents. Norepinephrine, catecholamines inhibits the melanogenesis, and autocytotoxicity, in which there is self-destruction of the melanocytes. And the fourth one is the exogenous chemical exposure that includes thiols, phenols that inhibit the activity of the tyrosinoids and causes cytotoxic action on the melanocytes. Next, we come to the etiology. Some of the etiopathogenesis we have already discussed. I have taken the etiology from different sources. So in the etiology, we have certain genetic predispositions, as we have seen that generalized vitiligo is having a family history. So there is definitely a genetic predisposition, with 35% cases are having positive family history. There is a nutritional disturbances, which includes low nutritious diet and the diet containing low protein, copper, vitamin, and minerals are responsible for development of vitiligo. Different endocrinal factors, which includes thyrotoxicosis, hypothyroidism, and diabetes, are also associated. We also have psychological factors, which includes the emotional stress and strain. Infections are there, infections responsible for enteric fever, focal sepsis, etc. There are various types of drugs, which includes quinanes, broad-spectrum antibiotics that can lead to development of vitiligo, and the other factors, which includes the chemical dyes, food adulterants, contaminated food, and water. So we have genetic predispositions. There are various nutritional factors, nutritional deficiencies of certain minerals, endocrinal factors, psychological factors, infections, drugs, and other factors that are responsible for the development of vitiligo. So I have given you in the e-notes the different slides showing the importance of all these factors, the triggering factors, the genetic factors, the cellular factors, and the environmental factors that are responsible for development of vitiligo. So I have shown triggering factors, various triggering factors that is triggering the development of vitiligo. It includes different type of drugs, infections, focal sepsis, and toxins. In the genetic factor, there are certain mutations in certain genes. In the cellular factors, we have imbalances in the antioxidant systems, etc. And in the environmental factors, we have ultraviolet light ionizing radiations, water pollution, heavy metals, etc. So all these things are basically responsible for the melanocyte death. In the another PPT, I have shown you the various factors like the genetic factors, autoimmune factors, nervous system defect, oxidative stress, trauma, stress, viral agent, and intrinsic defect that can lead to the melanocyte loss and leading to the development of the vitiligo. Now we come to the pathology. The pathology that is responsible for development of vitiligo. Defect in tyrosinase is responsible for development of vitiligo. So there is defect in tyrosinase activity. This is an enzyme that is responsible for the melanin pigment production. So melatonin secreted from the nerve endings inhibit tyrosinase and thus interfering in the pigmentation formation. So defect in the tyrosinase, this you have to remember, there is defect in the tyrosinase enzyme that is responsible for that is interfering with the pigment formation of normal melanocyte. There is a marked absence of melanocytes and the melanin in the epidermis. And in the inflammatory vitiligo, there is raised erythematous borders with infiltrations of lymphocytes and histiocytes. Now we come to the clinical features. What are the clinical features of vitiligo? What are the signs and symptoms with which the patient can come to us? Usually the symptoms in vitiligo, there are no symptoms, only there is depigmentation of the skin. So vitiligo can occur in any age. So the patient of any age group can come to us, and 50% of the patient of vitiligo are coming to us before the age of 20 years. It is slow progressive. The vitiligo is progressing slowly, and there is onset is slow and insidious, and it come to the halt and increases again. So there are phases in vitiligo. First of all, it increases, then becomes stays at halt, and then again increases. Distribution, there are certain areas which have special affinity for the development of vitiligo, that is for the depigmentation. It is found commonly on the face. So on the face, the vitiligo is very common in the axilla, groin, areola, and the genitalia. These are the areas of that are most predominant of development of vitiligo. That is face, axilla, groin, areola, and the genitalia. The areas that are subjected to repeated friction, like we have the dorsum of the hand, we have feet, elbows, the knees, etc. These sites are also predisposed for development of vitiligo. And vitiligo is usually symmetrical. So in appearance, it is seen usually symmetrical. There is a clinical classification that is given for the diagnosis for vitiligo. And the stages are divided into following parts. We have stage of vitiligo, that is V. In the active phase, it is termed as V1. Quiescent or stable phase is known as V2. And improving phase is known as V3. So we have stage of vitiligo. V is represented as vitiligo. We have V1 active, V2 quiescent stage, and improving stage is V3. So in the active V1 phase, there are new lesions that are developing. So we have new lesions developing in the active phase V1, and the lesions are increasing in size. So slowly and steadily, the lesions are increasing in size, and the border of the lesions is ill-defined. Next, we have the quiescent or the stable stage that includes there is no lesion that are developed, and the lesions are of stationary in size with border hyperpigmented and well defined. So in the active phase, it is increasing. In the quiescent stage, it comes to a halt, and the lesions are not actually increasing, and no new lesions are developing. And in the improving phase, the lesions that are previously present are converting into the normal skin. So the lesions are decreasing in size, the no new lesions are developing, and borders are defined, and signs of spontaneous repigmentation are seen, which includes follicular and peripheral signs. There is also one more variety that is known as zostiform or segmental vitiligo. In this, there is unilateral distribution of the lesions, preferably along the course of the nerves. So we have zostiform or segmental vitiligo, in which there is unilateral distribution of the lesions along the course of the nerves. How to diagnose the case of vitiligo? Although vitiligo can easily be diagnosed but just by looking at the patient, but it can be confused with some other diseases like pityriasis versicolor, etc. Pityriasis is basically a fungal infection. So the patient also looks a little bit like vitiligo. So the diagnosis, it is usually apparent by the appearance, and wood lamp examination is of great importance. So whenever it is asked, you have to write in the copies that we can go for the wood lamp examination. I have given you some of the pictures of the wood lamp examination in the portal, so you can go through it and see the difference, how to diagnose by using wood light examination. Now we come to the prognosis. What is the prognosis of the case of vitiligo? Whenever vitiligo patient is coming to us, what is the prognosis? In the prognosis, we have certain resistant areas. Resistant areas means those areas in which if the lesions are present, it is very difficult to get them treated. So the resistant areas includes the lips, over the joints, acral areas, patches of the depigmented hairs, if the hairs are depigmented, and patches lack vascularity if the blood supply is not there, patches with thickened integument and scaly tendency for fibrosis. There are certain factors that are responsible for the poor response of the treatment. It includes poor nutrition if the patient is not taking proper nutrition, emotional stress if the patient remains in the state of stress constantly, recurrent infections, extensive coverage, endemic areas, and age above the age of 60 years. So poor response is seen in case of poor nutrition, emotional stress, recurrent infections, extensive damage, extensive coverage, endemic areas, and the age above 60 years. Now, how to manage the case of vitiligo? The case of vitiligo can be managed by using PUVA therapy, that is Sorelians plus ultraviolet A, PUVA. Sorelians plus ultraviolet A that is very effective. Alternate sunlight exposure can be given. Systemic steroids in case of extensive involvement can be given. Laser treatment, if the patches are very small, then laser treatment can be given. And last is the skin grafting. Apart from this, there are a lot of homeopathic medicines which can be given in case of vitiligo. I have mentioned all those medicines on the portal in the e-notes. You can just go through them and you can check for the different medicines. So this was all about the vitiligo. I hope you have understood this session. So this session is powered by digital version 2.0 JAYOTI VIDYAPEETH Women's University. I hope the session is clear to you. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. Have a good day.